Hello students, we'll discuss a case scenario which is again quite common in regular day-to-day care which we may come across in surgical OP. Just see this, what is this? See that there is a pedicle here and there is a projected part. So like this or like this, like this. So this is pedunculated lipoma. So earlier lectures, please scroll back. I have discussed the pedunculated papilloma, where surface is fawn-like or finger-like projections with the velvety surface. Whereas here it's a smooth lobulated surface. There is the only difference. So often it is difficult to differentiate clinically with the both. So pedunculated lipoma and papilloma looks similar. The pedunculated lipoma is from the subcutaneous fat, tumor arises and drags the skin outward from the pedunculated area, but pedicle contains the tumor, so go deep and remove it. So it is a soft lobulations over the surface, whereas papilloma it is from the skin itself, the cutaneous tumor. So surface is irregular with fawn-like or warty appearance. That's a very typical of that papilloma. Otherwise, there is a clinical difference. Sometimes very often difficult to differentiate. So you should always say differential diagnosis. But treatment-wise, always under local anesthesia, remove the pedicle, go deep with an electrical incision and put suture. But go deep and remove the root. That's important. Otherwise, recurrence can occur. Like same like in papilloma. So this is the differential neurofibroma and other. Remember, it's a lipoma. So natural multiple can occur. All of you know that lipoma is universal tumor, and lipoma is the commonest benign tumor in the body. There is it's called as ubiquitous tumor. It can occur anywhere in the body, subcutaneous, in the muscle, outside of the muscle, in the bone, in the thorax, in the abdomen, in the cavities, except in the brain. So everywhere it can occur. It might be localized or diffused. So you can always go through my SRB manual of surgery chapter swelling. You get detail about the lipoma, because lipoma itself is a short case. Viva they will ask, short note will come, voxy will come. So slip sign is very typical in lipoma. So complications, lipoma, everything. So you can go through my manual of surgery and clinical method of surgery to have a better idea. So this is pedunculated lipoma. Papilloma I already discussed. So you can always scroll back and understand. So it's a benign lesion. It can be left alone, but sometimes ulceration occurs because of the friction. Pain occurs, bleeding occurs. Cosmetically, sometimes patient is worried. Such a situation, excision under local anesthesia with the electrical incision is always send it for histology. That's very important. Every specimen, whatever you are removed, send it for histology. Basic essential thing. So students, I again request everybody to subscribe my YouTube channel. It is free, so that you can really get a updated surgery topics for brief 5 to 8 minute lectures with the case scenario, often images, instruments, brief operative procedures. It will increase your surgical knowledge with the short specified periods. So daily you can go through it and enjoy and understand. The two things are there. So please subscribe my YouTube channel. Now, urachal cyst is A, B, C, D. Find out the right answer. Put it in the comment box. I will acknowledge and appreciate your answer. And answer them again. Mutation-related protein to type 2 generalized neurofibromatosis is neurofibrin, merlin, alpha-globulin, beta-globulin. Put the right answer. I acknowledge your answer, and also put the right answer at a later period. Students, again, quotation of the day is: you can't start the next chapter of your life if you keep rereading your last one. Past is gone, past is finished, and present is going on, and future we don't know. Future is a mystery, past is history, and only present what you know. So concentrate on the present. That's what exactly we can't keep on telling what has happened. There's no point, because you are look forward. That's what exactly it means. It's the quotation of the day. So students, again, please go through my SRB manual of surgery and SRB clinical methods in surgery, and also go through my SRB's surgical insight YouTube channel. Subscribe it. It is free for your daily understanding of and increasing your knowledge about the surgery as such. So students, please go through my SRB's manual of surgery. It gives detail about all CBME syllabus and covers both for MBBS and postgraduate also. but we've got MCQ for each topic wise. General surgery, gastrointestinal surgery, urology, specialty basics, urology, neurosurgery, cardiothoracic, all those basics are covered, instruments, adjuvant therapy, chemotherapy, briefly about anesthesia, specimens, briefly about anesthesia, briefly operative surgery, and current recent advances also, everything covered with the quotations, with the illustrations, with the photos, everything is covered. It's more than sufficient for undergraduate to go through this book, learn surgery and face exam, place MCQs, everything for both UGs and postgraduate. Also go through my clinical methods in surgery with the video of how to examine in each topic. It is a detailed examination method, but of course there is no management in this. It is a clinical book, and briefly in a tabular form, differential diagnosis and good photos and exactly how to examine and how to write case sheet of each different topics, ulcer, swelling, breast lump, and everything covered. Briefly orthopedic also. It also has got specimens, images, instruments, which can always be useful when you take Viva and Oxy and practical exam. So very, very useful, because we have all videos of how to examine a patient. It's very, very important in your practical exam of any medical graduate of any type. It will be very, very useful. So please go through it and have it. And my operative surgery, the 2-volume book, new edition has come, and it was extensive discussion about the methodology, technical principles, and steps of the different operations, major to minor, everything is covered with around 10,000 illustrations and photos. And my tissue atlas of tissue approximation, small 100 pages book with the video, how to do suturing in different situations properly with the video. It has shown very well, and can always go through that. And my DigiNow lectures through JP Publishers, around 220 hours, covers everything, A to Z topic, urology, specimens, instruments, clinical examination, videos, everything it is covered. Please, you can purchase for a year, so that you will have the clear idea. You can face the exam, have the clear idea, academic part, everything. You'll have entire subject is covered, including clinical part. So please purchase and have a clear idea about subject and to face the students. I hope you understood this lecture very well. Thank you so much.